Good day, my name is Alfaran S. Addog, BSN1 student of Notre Dame of Tacloban College, and this is my grandmother. Today we're going to continue our demonstrations on head-to-toe assessment. Equipment to be used, stethoscope, pen light, and tongue depressor. But good day po ma'am. Today po ma'am is magkakaroon po tayo ng assessment sa inyong chest, nose, mouth, ears, and neck. Okay lang po sa inyo ma'am? But before that, before I proceed to the assessment, I have to ask for my patient about her health history by asking if she is experiencing cough, dyspnea, and chest pain to have comparison with previous illness and present health condition. Ma'am, before tayo mag-proceed, ma'am, pwede po malaman kung yan po ba kayong ubo ngayon, ma'am? Nahihirapan po ba kayong huminga ngayon, ma'am?
Hindi na.
Masakit po bang dibdib niyo ngayon, ma'am?
Hindi rin.
So now let's proceed now to the assessing the eye structure and visual acuity. First is the inspection. We have to inspect the eyebrows for hair distribution, rationale, hair evenly distributed, skin intact, symmetrically aligned, and equal movement. Next is inspection for the eyelids, ability of blinking. Rationale, lids closed, symmetrical. Next is the inspection for the conjunction, lining the eyelids by reverting the lids. Rationale, shiny, smooth, pink, or red. Next is the inspection for the cornea, clarity and texture. Rationale, transparent, shiny, smooth, details or iris are visible. Next is inspection of pupil for color and symmetry of size. Rationale, black in color, equal in size, normally 3 to 7 mm in diameter, round, smooth border, and it is flat and round. Next is pupil reaction to light. Rationale, illuminated pupil constricts directed response, and non-illuminated pupil constricts. Next is reaction to accommodation. Rationale, pupil constricts when looking at near object, pupils dilate when looking at far object, and pupils converge when a near object is moved toward nose. Next is the assessing the ears. Inspection for auricles, color symmetry. Rationale, color same as facial skin. Next is palpation for the auricles for elasticity and areas for tenderness. Rationale, mobile, firm, and not tender. Pin recoils after it is folded. Next is hearing acuity, client's response to normal voice tones. Rationale, normal voice tones audible. Ingit mo kayo na. 1, 2, 3, 4. Next is client's response to whispered voice, non-consecutive numbers. Rationale, able to repeat non-consecutive number. 8, 11, 12, 13.
8, 11, 12, 13.
Next is the assessing the nose. First is the inspection. Inspect the external nose for any deviation in shape, size, or in color, in flaring or discharge from the nares. Rationale symmetric and straight, no discharge of flaring and uniform in color. Next is the palpation. Palpate external nose to determine any areas of tenderness, masses, and displacement of bone and cartilage. Rationale, not tender, no lesions. Next is patency of both nasal cavities. Rationale, air movement is restricted in one or both nares. So let's proceed now to the assessing the mouth and oropharynx. First is the inspection. Inspect the lip and buccal mucosa. Rationale, uniform in pink color. Lips. Next is the inspect the teeth and gums. Rationale, pinkish gums, smooth, white, shiny tooth enamel. Next is the tongue or floor of the mouth. Rationale, central position. Next is the inspect the tongue movement. Rationale, moves freely, no tenderness. Ma'am, pwede mo pakilabas ng dila, ma'am? Next is the inspect the oropharynx and tonsils. Inspect the oropharynx for any color and texture. Rationale, pink and smooth posterior wall. So now let's proceed now to the assessing the neck. First is the inspect the neck muscles. Rationale, muscles equal in size and head centered. Next is the observe head movement. Rationale, coordinated, smooth movement with no discomfort. Next is the palpation. Palpate the thyroid glands for smoothness. Rationale, loads may not be palpated. Next is the assessing the thorax and lungs. First is the inspection. Inspect the shape, symmetry of the thorax from posterior and lateral views. Rationale, symmetrical chest. Next is the palpation. Palpate the posterior thorax. Rationale, skin intact, uniform temperature. Next is the palpate the posterior chest for respiratory excursion. Rationale, full and symmetric chest expansion. When the clients take a deep breath, your thumb should move apart in an equal distance and separate 3 to 5 cm during deep inspiration. Maminga po tayo ng malalim, ma'am. Isa ko po. Thank you po. Next is the inspection. Inspect the anterior thorax. Inspect the breathing pattern. Rationale, regular rhythm, rate of 16 to 20 minutes. Inhale. Exhale. Inhale. Next is the auscultation. Auscultate the breath sounds. Rationale, normal breath sounds, vesicular bronchi, vesicular, and bronchial. So now let's proceed to the auscultation of the rate in all of four anatomic sites, which are aortic, pulmonic, tricuspid, and mitral or apical. In every area of auscultation, distinguish both S1 and S2 sound. Rationale, a normal beat of 60 to 100 beats per minute, and S1 and S2 must be heard in all sites. So in auscultation, you are going to use the stethoscope. But before that, make sure na open or close ang inyong diaphragm. So let's proceed now to locate the pulmonic valve from the sternum going. So this is the sternum going to the left 2 finger breaths. So this is now the pulmonic valve. So you have to listen it. Kung merong narinig na malakas na pulsations, that means that your patient has a problem on his or her heart. Next is going back to the sternum. 2 finger breaths going to the right side, and this is now the aortic. Next is locating for the tricuspid. Next is the mitral, just below the nipple. Then that's it for the assessing the eye structure and visual acuity, ears, nose, mouth and oropharynx, neck, and lastly is the thorax and lungs. That's it for the day. Thank you and have a good day. Goodbye ka.
Goodbye. Bye-bye.